for DNB and I completed. Yes. So after my MD Psychiatry, in the next academic year, I applied for my DNB and I got my DNB degree as well. I think that is why Dr. Gaurav sir had asked me to help you get oriented towards the DNB psychiatric examination. So first things first, I would say DNB practicals, especially in psychiatry, has a good outcome. So the main thing that you have to take into account is that you be calm, be present, and use all what you've learned in your 3 years of residency and answer the questions to the point. That is the only thing that I would say is necessary for you to pass the examination. Rest everything is supplementary only. So this particular session is not going to be an academic session. I'm not going to teach you that this is something that you have to read, this is something that you have to learn, or I'm not going to give you the questions and answers everything, because it's going to be there in from your entire preparation. What I'm going to do is orient you towards how this DNB practical examination is conducted across various centers in India. Okay. So introduction, like preparing for the travel, reaching the venue, etc., because this DNB people are very. Can you please mute yourself? Once you have a doubt, we can have an. Okay, I am audible, right? Great. So the DNB people are very notorious to put our practical exam centers very far away from us. So people from the south are given centers in the north, people from the north are given centers in the south, and vice versa. So prepare for your travel and reach the venue in advance is all very important, that to be discussed. What are the parts of the exam? There is an OSCE for 100 marks, case presentation, 2 long cases, 50 marks each, total 100 marks. And then you have ward rounds, which was initially kept as spotters, etc. But now it is kept as ward rounds, which is for 60 marks. And Viva was 4 tables, 10 marks each for 40. So total of 300 marks, you have to take 150 marks to pass. Okay. So the third thing would be your checklist, which you have to know. Basically, you have to have your coat or your apron, a CNS kit. It is better to have it in hand, even though there are not many centers who keep neurology cases regularly. They do not have it, but we cannot be surprised if one particular examiner wants you to test some neurological finding and tell you. So it is better to have a basic CNS kit with you, like we have for any other practical. Even medicine people do have it, right? So that, and keep couple of pens which are legible, and try it out before the exam itself, and keep an exam pad. And very important thing for any practical exam that we say, from MBBS onwards, we know that for clinical examination, we should be well groomed, have a good haircut, shave, have a clean shave, wear a neat shirt, light colored clothes, groom yourself well, because that is playing a very important part in your exam. Right. So have a checklist with you so that you don't forget any of these before your exam. And preparation, I would say revise everything, whatever you have read for your theory exam, whatever you have read for your clinical, discussions and case presentations, etc., etc. Read everything, revise everything, read tips, notes. There are 3 volumes. All of these are given into the point. So it gives a quick read for you to revise all of these topics to help you in your OSCE, your case presentation, even in your Viva. Right. Especially latest drugs and mental health care act of 2017 and other acts are usually asked. We'll discuss this again. Right. And the most important thing, be calm and you can pass the exam. So going into the introduction, like I told you, since the exam centers are put very far away from general people's addresses, you have to plan your travel in advance. I know the exam is this weekend, so this is pretty late, but still make sure that you reach the place of that exam center the previous night itself. Don't go on the day of the exam morning. That might go wrong in various ways, and it can even mess with your brain, making you tensed, making everything go a little very on the edge, etc. So make sure you stay at the exam district. I just the place where your exam is held. Make sure you book a room or something, or stay with your friend the previous night, and visit the center if possible the previous day itself to make sure you know the location correctly, because sometimes the same address would be tricky for the auto rickshaw people or the taxi driver. So you should know where the location is exactly. Most important thing is, do not reach the center in panic. So pack all everything necessary, and plan your travel in advance. This would be something that people will feel is, why would somebody discuss this in a practical orientation class? But according to me, this is the most important thing. Appearing for an exam in a calm state of mind, in a good, mental status would help you pass the exam. So these are very necessary prerequisites for that. So coming to the exam parts, in general, so OSCE is one of the most important part. It is the first part, and it is going to fetch you a lot of marks. It is a very good area to fetch a lot of marks because it is almost like a theory exam. Right. So OSCE is actually conducted in a centralized way. Okay. So what they will do is, in your exam center, when the exam is starting at 9 o'clock, around it is around 9 o'clock or 10 o'clock, I'm not sure. So at that 9 o'clock, in all these centers across India, the OSCE people will be starting. OSCE will be starting at the same time, because the questions will be projected from the Delhi NAT board center itself at the same time in all centers. So make sure that you are getting a seat where the projector screen is visible. If it is not visible, or if you're having any difficulty looking at the screen, inform the examiner previously and get it changed or corrected. Okay. And they will give you like 10 answer sheets for 10 OSCE questions. And you have to write your exam number legibly in all of these papers. Make sure that you write the answers quickly, legibly, and to the point. Because OSCE questions, sometimes it might require 1 or 2 lines, but basically it will be like few words only. Okay, you don't have to write it in proper English sentence with the sentence formation, etc. They just need the accurate, precise answer. Sometimes if the question paper itself will say, this part is carrying 1 mark, this part is carrying 2 marks, this part is carrying another 1 mark. So depending upon that also, you can increase or decrease your answer. But basically you have to answer fast, because it is in seconds. I think around 30 seconds or 60 seconds is given for one answer. I don't remember it correctly, but it is in seconds. And after one question, that is one OSCE, they will give you 15 to 30 seconds for the examiner to collect your paper. The next OSCE is displayed only after that waiting period. Okay, and only answer on one side of your answer sheet. Don't go to the back side or extra sheets, etc. Because only one side of the answer sheet will be scanned and uploaded to the NAT board people from your exam center. Okay, and basically this will be monitored by CCTV across the NAT board itself. So I would say, do not attempt to even peek into your anybody's paper, because it will be very much taken seriously. Okay, so for OSCE preparation, every topic is given importance. So read as much as possible and revise everything that you already know. Important areas would be, they would give case vignettes and ask for a diagnosis, management related questions. Every act in forensic psychiatry is important, especially POCSO, Mental Health Care Act, National Mental Health Program, District Mental Health Program, etc. And sometimes even DSM criteria based questions are asked. So it's a mix and match of everything. It's not like this is asked, this is not asked. So everything can be asked. To get an idea of how OSCEs are asked, you can go to the TIPS website and download TIPS OSCE. Okay, I'll just show you how it will be. So this is the OSCE, fourth volume of TIPS is the OSCE volume. They have divided it into all of the types of questions. See, neuropsychological test, scalings, neuropsychiatry, neuroradiology, neurophysiology, psychoeducation, breaking bad news. So all of these questions are included. So they'll give you how a card is given. and these questions. See how the scoring is 1 mark, 2 mark for this, 1 mark for this. So it is based on it is similar to this, not like so many questions are asked or so little questions are asked, but this is how the OSCE is conducted, right? So if you read all of these, you will get an idea, and based on this you can further your preparation as well. Okay. Okay. Coming to the case presentations, it is not like a short case, long case, one long case, two short case, which is kept in most universities. No, for DNB, it is two long cases, which carries 50 marks each. They generally give 30 to 35 minutes for one case. The most important thing is you are not given the exam center in a place where you know the language. So for example, you know Hindi, but you are given a case in a Malayalam. If, for example, you know Tamil or in Malayalam, you are given a case in Orissa, Bihar. Can happen. So depending upon that, they will give you a translator. Make sure you build a rapport with the translator as well, because the translator know the nuances of the language, and they can actually ask the question that you want the answer for in a better way and get the answer in a faster way, instead of you are using gestures or anything to try and building a rapport with the patient. It's better to communicate with the translator. And sometimes the translator is a patient's attender or even the person who knows the patient well, so they can give quick answers. Times of essence, they are giving you only 30 minutes for the case. Okay, and do not spend much time in writing. The case sheet is not even checked in most of the centers. It is for noting down important points and formulating the case. You know, you cannot remember everything from the memory, so it is basically for noting down important points. Do not spend much time in writing an entire case sheet. So the discussion part usually depends upon the examiners. They let you present the case, ask clinical questions, management related questions, even sometimes theoretical and recent advanced questions are asked entirely upon the examiner. Most important thing is do not panic, because cases are generally not too difficult. They expect the clinical sense, they expect the history taking skills, and the mental status examination skills, and the way you answer the questions is what is taken into account. They do not make the case per se difficult. So generally they keep schizophrenia cases, BPAD cases, depression cases, substance can be of varied varieties. You can get substances which you're not exposed to because it is a different region. So you need to read upon all substances, and OCD, etc. are given preference. And the diagnosis, if you're giving in ICD-10, they ask you for ICD-11 and DSM-5 as well. If you're giving in DSM-5, they do ask you the equivalence in ICD-10 and ICD-11. They mix and match upon this. Whatever you give, they also ask about the other classification systems. Now coming to ward rounds, this is a new area. Previously, spotters were given so much of marks. This is almost similar to spotters only. And in some exam centers, they do not conduct these ward rounds part of the examination in a full-fledged way. They sometimes combine it with the Viva tables, and they give scenarios and ask questions. That happened with me. But, we cannot rely upon that. They might even take you for the actual ward round. So what happens is, what they're expecting is patient examination protocol, general examination of a patient, examination of extrapyramidal symptoms, how to adjust medications depending upon one particular symptom getting improved or not improved on a particular day of ward rounds, or checking vitals, etc. This is what is examined. Sometimes scenarios are given, and the procedure for voluntary admission and involuntary admission according to the Mental Health Care Act of 2017 is asked. So basically, our acumen during patient rounds is tested. Again, don't panic. So if they're taking you to the ward rounds, they will take you to the patient side and ask you to examine the patient, or ask you to do a mental status examination of the patient, or they might ask you to check the patient charts and look at the drugs and ask you questions based on that. That will be done. Or else, for like how it was conducted for me, in the Viva itself, some people ask about ward rounds. So two tables were asked about ward rounds along with their special table topic. So what they did, they gave me scenarios. So for example, you're going for ward rounds on a day. This is happening to a patient. What will you do? Or you're going for an admission day. This is a patient brought to you. How will you admit this patient? So such questions with scenarios in a ward rounds can also be asked. Okay, so again, this is also simple. It's based on your clinical acumen and your knowledge. It's not very difficult. Okay, it's pretty manageable. Coming to the Viva, There are generally four tables. Usually the examiners decide and divide amongst themselves. There is no proper guidelines from NAT board that these are the only four tables that you can keep. No, they actually divide it amongst themselves. Sometimes people take even two topics for a particular table. Sometimes one internal examiner sits with one of the external examiners. Can happen. So usually the subject areas are specialty psychiatry, probably child and adolescent psychiatry, and neuropsychiatry combined, etc. Gender psychiatry, psychology, forensic psychiatry, recent advances, psychopharmacology, etc. are the basic divisions. In psychopharmacology or even gender psychiatry, they can ask you to pick a drug and ask you indications, contraindications, routes of administration, side effects, available Indian preparations, etc. They ask you about Schedule H drugs, pregnancy and lactation indication of a particular drug, or what are the precautions in that particular drug. They ask you to pick up a psychological test like gender bestall test, or even Batia's battery, or sanguine form board test, etc. They just ask you to pick, and they ask you questions based on that in psychology. So the table viva varies. So depending upon the resources in that particular center, they set up the table. Okay, so sometimes each ECT procedure, RTMS procedure, etc. is asked. Basically, recent advances table is very difficult because you need to be very updated with the latest drugs. Sometimes the particular drug that your examiner is updated with may not be the same drug that you studied with, about. So recent advances is a little tricky table. So it matters how you manage that. So tell them explicitly that you do not know about this particular drug, and move on to the next question. Do not waste time thinking about it if you actually don't know. And landmark papers obviously are asked. They ask about star D and all the important landmark papers that we usually discuss. They ask about how it is done and what is the significance, etc. Statistics part. Right. So Viva, I don't think I can say this is what they will ask, this is what they will not ask. Basically, from whatever you answer or do not answer, the question stems from that. So that is how Viva usually progresses. That is the same in DNB practicals as well. Right. So basically, be calm, attend the practicals, you will definitely pass. There is a higher pass percentage in psychiatry. All you have to do is be present and think about what you've studied in your residency for the past 3 years, and ask it out. So if you have any questions now, we can discuss, or else you can also reach out to me. So I'm just ending the sharing and opening the floor for discussion. There's a couple of chat questions. Do they ask biostatistics in OSCE? Yes, it is expected. They do ask one question probably, but it is included. What about neuro cases? So as far as I have discussed with people around the various centers, neuro cases are not generally kept for the long cases, but be prepared. That's what I would say. We cannot be sure. Generally, the cases are psychiatric cases only, pure psychiatric cases. Hi, ma'am, will they give translator for sure? Yes, 100% sure. Because see, my center was in Kerala, and the people who were with me did not even have a clue about what Malayalam is. And the patients, some were of different language, not Malayalis per se. So they gave a translator according to the patients. Diagnosis and criteria, usually what is expected is, if you are having a diagnosis, getting well along with ICD, it's better to go with ICD. But if you feel like that particular diagnosis goes better with a DSM kind of diagnosis, then you can use DSM. But you have to explain why you have chosen ICD or DSM. But to answer it plainly, ICD better. Are we supposed to do complete neurological examination in psychiatric cases? It's given only 30 minutes, so it is not expected of us. But when we are presenting the case, you will present obviously any neurological deficits are there. So it's that. Do we say MSc according to the IJP consensus now, or the old way is okay? Which I would say, whichever you have been practicing for the past 3 years is better. Don't go for any new consensus, like IJP consensus, that recent one, or even new proformas that you're reading now for the exam. No, go with whatever you've practiced, because they are well aware that you're not from a particular institute. You are a mixed batch from various institutes. So whatever is followed in your institute is better, in a way that you are used to that particular pattern of presenting. For long cases, what will the time? That's what 30 minutes was given. It's totally 1 hour, 30 minutes per case was given, and then the cases were shifted. So usually they'll give a lot, and you will have to choose a lot with, in the lot itself, there'll be written numbers. For example, 1 and 11, and then 2 and 12, example. So when you pick the lot, you will get both the cases, and depending upon the order, you'll be asked to take the first case or second case. And after 30 minutes, bell will be rung and you have to change. Again, as far as we have discussed, child cases are not usually kept for examinations, but I cannot be 100% sure. But as far as we have discussed, no child cases. Timings and breaks in between, that's what. So once you enter the exam hall, you'll be given a room where you can prepare or something. And then that's where you keep your things, etc. Then you go into the main hall where the exam is actually conducted. OSCE will be conducted. In OSCE, between the 10 sessions, 10 questions, in between there's a, after 10, after 5, after 50% of the questions, there is a small break. But you cannot go out. It's just a breathing space. And after OSCE, there's a break. You can go have a cup of coffee, all of those, and then you will come back for your questions, case presentation. Then after taking the case, you will be sitting in line orders, right? When the examiner is asking you to come and present, then only you will go. So that will be actually a breathing space where you can content, as long as you are not in the first number or something, you can think about the case and write it out, and all of those things can be done. At that time also, you can drink water or take a break, right? After that, it is lunch, and then only ward rounds and viva. This is how it was conducted, but there might be variations. Timer for the viva, yes, actually, the examiners wanted to keep it on time. So what they did was, for a particular table, for a particular candidate, they gave like 5 minutes or something. They divided according to themselves. And after that, a bell was rung. And within that time, however we have performed with that particular table, marks were given. Carry our thesis for the exam? No, not necessary. It was not asked. It was not asked. It was not even given in the DNB practical thing. But if you are a primary DNB student, you will have to verify that with your mentor or whoever is in charge, your guide. If you have it, you can carry it. But no, it was not asked. Anybody else? Any other questions? Are we allowed to go out for lunch, or is it provided? It's provided inside. I mean, the exam fees is including all the lunch and all the refreshments. So it is provided inside. Can a session for theory paper be taken as well? I don't understand your question, Garima. Can you be a little more clear? What to read in recent advances? Okay, so the latest drugs, the recently approved FDA drugs, the drugs that are in the pipeline, any new psychotherapeutic interventions, about RTMS, about OCD. So basically, drugs are more important. So there is a recently a pipe approved drug for postpartum depression, zuranolone. Initially, it was for IV only. Brexanolone, now zuranolone is approved. Dexmedetomidine is an approved drug. Then brexpiprazole is approved for Alzheimer's disease. So all of these are important. In every class, a new drug can be asked. So if that is the only table, they go, left, right, and center and ask all types of questions. It's better to say I don't know. Let's go to the next question. Are we supposed to present verbatims in content of thought, especially if it's in local language? So if it's in local language, you cannot present verbatims. So you present in English as what is translated by the translator. They will understand. No, they don't expect verbatims, but it's not possible, right? From where to read recent advances? I am not sure if tips has some content on recent advances. I'll ask Dr. Gaurav sir to clarify for you. But other than that, there was a tips session on recent advances in the last or the year before that. So that is a pretty good area to start with. That is there in the tips website itself, the PPT. Other than that, you just have to Google and study. No, download papers.
Yeah, it's there. It's there. The recent advances are there, but again, they are like 2 years old. So obviously, you have to like keep on
Yeah.
searching whatever is there, recent articles, and then you
Yeah.
have to like study for that.
Yeah, that's what. So there was a recent advances class taken in tips per se. So I think there are around 2 to 3 PPTs available in the tips website. You can download that, and from that you look for other recent articles. You keep that as a base and look for recent articles. For a long case, do we have to present the whole case or only formulation? Whole case presentation was asked. I don't think no anybody asked for formulation alone. But at the end, are they asking for formulation or not depends upon the examiner. But you have to present it as a whole case. For MD, we had a kind of extempore session on a topic. Do they have it in MD and B? No, there is no extempore session. So I attended my DNB practicals while my son was around 6 months old. I did not have time to prepare anything in very detail, right? And it was the day after a family ceremony as well. So my point is, it is easy to crack once your fundamental is strong in psychiatry. I passed, and everybody who attended with me also passed.
And how long does the practical last for?
The whole day, sir. Around 3 to 4, it got over. So once the viva is over for us, we are allowed to go.
Okay. And how's the passing percentage right now? Like, what is the statistics?
Passing percentage, especially in psychiatry, is good, sir. I met somebody in ANSIPS as well, the examiners and the people who attended with me. That's what they said. It's around 80 to 85% pass percentage in psychiatry. So it's good, actually. We are lucky, but in some subjects, the pass percentage is very bad.
Just see if other people have any questions.
It's pretty good. From 8 people, 35 have attended. That's good.
Yes. It's a hot topic.
Yes. Hello, ma'am. EG, CT, MRI, IQ tests are taken in the part which contains 4 table viva or only OSCE. It's both, sir. For OSCE, they can put an MRI and if, for example, a very obvious finding and they can ask you questions based on that. That is also possible. For table viva, that is definitely there. Post MD have any advantage in passing? I'm not sure. It depends upon you only. But they do ask you why are you doing DNB in the practicals. Mandosky, no. See, this is what it's centralized. It's put on a projector screen, and the questions are displayed, and you have to just write it. That's how it is. It is done the same across India, so the time is very important. They cannot keep a manned station in that particular format of the exam. This was conducted last year, so if that is the same format formed, there is no manned OSCE stations. Expected dress code is formals. For females, it is not like anything specific was mentioned, but I would say a formal chudidar or anything would be good.
Arman, like what I would request from you is like if you could just share some of the recent advances, if any article you find, and
Yeah,
I'll also share the whichever materials there in the tips so that people can study for the exam.
sure.
And thank you so much, ma'am, for coming. And I think there are some more questions.
No, OSCE is the first thing in the morning. First thing in the morning. Rest everything maybe they can shift it because it is localized, right? The examiners in the particular center can decide that, but OSCE is centralized and it's only in the morning. Thank you. Thank you.
Well, thank you so much, ma'am, for your session, and thank you so much for taking time your from your busy practice. Last question, I think somebody asked neurokit and ophthalmoscope to be carried.
If you have it, it's better to carry, sir. Neurokit, I said it's better to carry, but there was no neuro cases or there was no insistence on examination of neurological system. But if there is an examiner asking you to examine, and if you do not have, that could be a problem. So if you have it, it's better to carry.
Right, I think people have to study for their exams. So thanks again, ma'am, for the session, and it was really very useful session, brief and
Yeah.
crisp. And if you could just share the recent advances in the group, it would be very useful for the people who are actually taking the exam. And thank you so
Definitely.
much for joining, and thank you so much, ma'am, for your time.
Thank you, sir. Thanks for the opportunity. Bye.